Vitrectomy or vitreoretinal surgery is one of the most complex surgeries performed in ophthalmology. For a normal person, the eye from outside looks normal in these patients. It's very important to understand what is vitreous, what is retina, what is the disease that is causing, and what are the treatments that are done during vitreoretinal surgery. Let us see these in various videos and pictures.
The vitreous is a clear jelly-like substance that fills the center of the eye. It is composed mainly of water and comprises about 2/3 of the eye's volume. The vitreous helps the eye maintain a round shape and is attached to the retina at various points, including the macula and the optic nerve. The retina is the nerve layer that lines the back of your eye. The retina's function is to sense light and create impulses that are sent through the optic nerve and to the brain.
Compared to cataract surgery, the instrumentation involved, the skills of the surgeon, and the various consumables that are used during vitreoretinal surgeries are much different and more complex. The surgery also involves very delicate maneuvering, and the success depends on many factors, including the health of the retina after the surgery.
Vitrectomy is a procedure that treats disorders of the retina and vitreous. Vitrectomy refers to the removal of the vitreous, the clear gel-like substance that fills the center of the eye. An eye care professional may recommend vitrectomy surgery to treat eye problems such as diabetic retinopathy, retinal detachments, macular holes, epiretinal membranes, also called macular puckers, bleeding inside the eye, vitreomacular traction syndrome, which is when the vitreous is pulling or tucking the retina from its normal position, infections inside the eye, or to remove small pieces of a cataract left in the eye after cataract surgery. Before the procedure begins, local anesthesia and a mild sedative are administered for comfort and to keep the eye from moving. During the procedure, the surgeon inserts microsurgical instruments through tiny incisions made in the sclera, commonly known as the white of the eye. As the vitreous is removed, it is replaced with clear fluid, filtered air, gas bubble, or silicone oil. The fluid or gas is absorbed into the body over time and replaced by your natural eye fluid. If silicone oil is used, it does not reabsorb and is commonly removed in a few months following the procedure. Vitrectomy surgery is often performed in conjunction with other procedures such as retinal detachment repair, macular hole surgery, and macular membrane peel. The length of the surgery depends on whether additional procedures are required and also on the overall health of the eye.
All patients undergoing vitreoretinal surgeries must very well know what to expect after the surgery. Sometimes, in spite of the best surgeries, the visual outcome may not be as good as they expect. That's generally due to the overall weakening of the vitreoretina. You should discuss this very well with the doctor. And post-operatively, there are lots of do's and don'ts. Be prepared how long you have to take leave and what all precautions you will have to take. Sometimes there will be a requirement for an additional surgery. Discuss these with your doctor to have your expectations right and to be a happy patient.
After a vitrectomy procedure, it is common to experience some mild discomfort for a few days. Most patients will wear an eye patch home to protect the eye. In most cases, the patch can be removed the same evening before bedtime. Once removed, Eye drops are prescribed to ease pain and to prevent infections. Your eye care professional may also suggest that you wear a plastic eye shield while sleeping at night or showering to avoid getting water or soap into the eye. For most patients who undergo a vitrectomy, sight is restored or significantly improved after several weeks of recovery. However, for the first few weeks following the procedure, patients may experience decreased vision in the treated eye, often due to a gas bubble that obscures the vision until it is gradually absorbed. The eye may also be red, sore, or irritated, but these symptoms gradually diminish over time. And an ice compress along with over-the-counter pain medication can help reduce some aching and soreness. If you have severe or worsening pain that does not respond to over-the-counter pain medications, you should contact your eye care professional immediately. Recovery usually takes about 6 to 8 weeks. Although many people resume normal activities much sooner, it is important to avoid bending, stooping, lifting objects over 5 pounds, or any strenuous activity for the first week. If a gas bubble is used, air travel is forbidden until the gas is absorbed over several weeks, and you should ask your eye care professional when you may fly again. Vitrectomy is performed for many different problems and often in conjunction with other eye surgeries. The recovery period may vary for each patient. Your eye care professional will be the best judge of your individual recovery, so make sure you follow their advice carefully. The macula is the portion of the retina responsible for detailed central vision. As we age, the vitreous inside the eye can shrink and pull on the retina, creating a hole in the macula. In its early stages, a macular hole can cause a slight distortion or blurriness in the central vision. Reading and performing other routine tasks such as driving may become difficult. If the condition progresses, patients will experience a loss of central vision. If left untreated, the vision loss from the macular hole can be permanent. Most macular holes require a surgical procedure called a vitrectomy. During the operation, the surgeon gently removes the vitreous gel and releases the traction on the edges of the macular hole. Next, the surgeon injects a gas bubble inside of the eye. The purpose of the gas bubble is to place gentle pressure on the retina and help seal the hole. Following the surgery, patients must remain in a face-down position during most of the day and while sleeping at night. This routine will typically take several days to a week, but in some cases can take longer depending on the macular hole characteristics. This position allows the gas bubble to press against the macular hole, helping it to seal. As the gas bubble is generally reabsorbed by the eye, the vitreous cavity refills with natural eye fluids. Maintaining a face-down position is crucial to the success of this procedure. Because this position can be difficult for some people, it is important to discuss this with your doctor prior to surgery. The macula is the area of the retina that is responsible for clear vision. As a person ages, the vitreous inside of the eye begins to shrink. When this occurs in the macular area, the retina initiates a healing response with a migration of cells found within the retina itself. These cells form a thin layer of scar tissue known as a macular pucker or epiretinal membrane. If a macular pucker forms on the macula, you may notice that your vision is blurry or mildly distorted. This condition requires routine checkups with your eye care professional.